How much is it going to cost? Who's going to pay for it? They're presenting it like, oh, well, we're going to give you this savings. How's that even? How can you even say that?
Well, you can't. That's the problem. That's why the Blue Dog Democrats have revolted against him right now, because you can't say it's not going to cost you. It is going to cost you. Now, they have several estimates. One estimate is $1.7 trillion. A more conservative estimate by the Congressional Budget Office is $1 trillion. Now, out of that, to be given out to the program, you have to administer this program, and that's 30% of $1 trillion. That's not chump change. That's $300 billion. 1.7. That's going to be about $500 billion plus just to run this. Now, President Obama thought that this would, quote, reduce our costs in health care. Well, the Congressional Budget Office last Thursday issued the report and said absolutely not. It will not reduce the cost to the federal government and taxpayers.
Which is something they're trying to ignore. Of course, if they came out and said something differently,
absolutely,
it would be the first thing they would point out.
Yeah, that's like when the Titanic sank, it's not right.
They're independent.
Yeah, the CBO is an independent auditing agency that did their thing. It surprised the Democrats. And the Blue Dog Democrats, when they heard this, said, listen, we can't go back to our districts right now, because if we do and offer our people $1.7 trillion, another deficit after the TARP bailout, we're not going to have any money. And it's pretty ironic. Even the Chinese yesterday told our president, basically, you got to watch your budget. You're spending too much, and we own your treasuries. Yeah. That's like I was telling you. Just think about that. The communists are telling our government to be more fiscally responsible and not to spend too much money. And that's like a crackhead telling you to floss your teeth, to stay stable and healthy. It's ludicrous. So basically, yeah, there's a big deficit out there. Now it's $1.7 trillion added to that. And the CBO, Congressional Budget Office, says you're not going to save money. So where does it come from? It comes from us. It comes from the doctors, the hospitals, the pharmaceutical companies, the consumers, the patients. And how are you going to pay for that? This is how you do it. You're going to increase taxes on all Americans. All of us are going to pay a tax increase, number one. Number two, they want sin taxes. That's going to be on fast food, soda, beer, wine. That's going to be taxed. And then they're going to tax your insurance policy. Isn't that lovely? You're trying to pay less, they're going to tax you. And they're going to tax small businesses more money. So what happens is the small businesses, which are the economic engine of our nation.
Absolutely.
Think about this here, Blaine.
Create 76% of the jobs.
Now, here's something really interesting. My accountant told me this. He said in capital investment, large corporations like General Motors, Intel, IBM have decreased their jobs. Think about it. Haven't? Of course they have. They laid thousands. Pfizer laid off 10,000 drug reps. General Motors, bankrupt. 30,000 lost. IBM, 40,000 lost. The only people that are increasing job positions are small businesses like your radio station and my private practice. I employ about 35 to 40 people. So we're the economic engine. So why would you want to tax us and force us to hire less people and expand our services? And especially in cardiology, where we have Seaport and saved 160 lives or 170 lives this week. Why would you want doctors to not come here? Already, doctors are not coming to Frederick, Western Maryland, because we're a shortage. We're at 37% capacity. You know why? The federal government cut out new doctors through federal funding. Isn't that lovely? So if they paid them $238 million, you could have opened up a couple of medical schools with classes.
Let's take a couple phone calls, Doctor. If you just tuned in, talking about health care, Dr. Vitarello, Chief Cardiologist at Frederick Memorial Hospital. Bob, welcome to the program. You have a question for the doctor?
Yeah, I guess it's sort of tied into what he was just talking about. Where are we going to find the extra doctors and hospital beds and offices and equipment to take care of 56 million uninsured all of a sudden?
Well, that's a great question. Actually, 2 weeks ago, the White House was notified that if they do have these 47 million Americans right now, guess this, we're now down to 37% capacity in Frederick, Western Maryland for physicians. And the federal government cut back all the Medicare reimbursements to all the medical schools over the last 10 years to reduce the amount of doctors by 25%, thinking that if you have less doctors and specialists, you spend less money. Well, guess what? People living older, they're having more diabetes than ever. They need our health care even more and for our services. But now we're down to 37% capacity this year and down to 30%, guess what, by 2012. And, Bob, here's one further fact I want to give you. Check this out. 57% of all the graduates that we take care of and teach in the medical schools are all leaving the state of Maryland. You know why, Bob? Let me tell you why. The malpractice, we have no cap on malpractice, and we get paid. Check this out. In the United States, they have 319 billing districts. Number one is in Wisconsin. Guess what Frederick, Maryland is? 313. Baltimore, 319. We get paid the lowest in the United States. We get paid less than a small town in Mississippi. You know why? The insurance companies colluded with each other and fixed prices. They were able to talk to each other. Now, if doctors do that, that's called a monopoly. We go to jail. So what they have to do is think about, hey, guess what? What's the most important thing out there? It's the American public. And if you keep on driving our doctors out of the state of Maryland to places like Texas and North Carolina, when you fall off your bike or you have a head trauma accident, doctors are leaving our state. We graduate 80 neurosurgeons a year. Every year, 300 neurosurgeons are retiring. So we only have 2 left in Frederick. When they're gone, we're finished. That's pathetic. We don't have enough surgeons here. Our ERs are overwhelmed. So what's happening is medicine's taking a hit. They're not giving the right attention to the physicians. There's no tort reform. So as a result, our prices keep on escalating. And you're right. That's not fair to the patient because basically the patient suffers with this.
Bob, that answer your question?
Oh, absolutely. It sounds like even building a bigger hospital won't fix it.
All right. Thank you, Bob.
Sure.
Thank you, Bob.
All right, let's go to J.D. in Mount Airy. J.D., welcome to the program.
All right, thanks. I think the doctor's got some good points. And one of them he just mentioned was to reduce the number of doctors and the tort reform. You haven't seen the government trying to reduce the number of lawyers, and that's exactly what they're trying to do, is reduce the number of doctors to help ration health care. And that's what's being done in all these countries with socialized medicine. There isn't one country you can find that's happy with it, and that's the progressive movement that's trying to do this. And I think doctors are right for taking a primary interest in this, but I have yet to find a doctor that's read the health care bill that 1,018 pages, let alone a legislator. But the lawyers have sure put it together, and I don't think they've read it either. So,
Well, absolutely. And this is a great point you made. Let me tell you this fact. I was in England. In London Hospital in London, there's only 8 cardiologists on staff, certified. That's it. Out of several million people. What they do basically is you don't see a cardiologist when you have a heart attack. Well, in Frederick, Maryland, if you have a heart attack, within 60 minutes you get a stent, and we save your life. If you have a stroke in Frederick, Maryland, 100% of the times you see a neurologist, a brain specialist. That's appropriate, isn't it? You had a stroke. In England, 3% only see neurologists. Isn't that something? If you have erectile dysfunction, 2% see a urologist. That is it. A very unhappy, flaccid society there. It's not pretty. And what people are doing right now is, what they're doing is they want to save the money for other programs. What would you rather spend, $100 million on pediatric care or give it to Acorn? We have to make some decisions here. The public has to talk to their representatives, say, stop it now. We don't want socialized medicine. And this guy, Max Baucus, right now, the Senate Finance Committee, is a moderate. He's saying, I'm not for this public option, because that will drive private insurances out of business. And it's not like Medicare. So we're against a public option where the government makes your health care decisions. How would you like if you had a heart attack and we told you, hey, you're 20 pounds overweight, you're not going to get a stent, or you smoke? That's not right. And if all we've done for all these generations of great medical care, this is not the time to ruin it. Now, if this system was horrible, all right, and we had bad outcomes, please change it. But we're the gem right now in the world of health care. So why reinvent something that doesn't have to be fixed with our strategies, but we have to do reform and tort reform?
Catastrophic to the economy.
Absolutely. So you're going to kill those poor, all these people, these small businesses are going to pay for it.
Yeah.
Then there's a surtax they want to put on small businesses on top of that, and they're going to tax your health care benefits.
Well, and I think, Doctor, you'd agree that we need reform, but not this type of reform.
Absolutely. This is an anatomy of a disaster.